Welcome to Hamdard Medical. Today in this very lecture, we will be explaining the cubital fossa, the anatomy of the cubital fossa. So first of all, let me discuss the location of the cubital fossa first, that where the cubital fossa is basically lying, right? So the cubital fossa is basically present at the anterior aspect of the elbow joint, right? The word cubit is basically a Latin word, the cubital, that means the elbow joint, right? And the cubital fossa is basically a triangular depression that is present at the anterior aspect of the elbow joint, right? So first of all, regarding the location, you should remember that it is a triangular depression that is present at the anterior aspect of the elbow joint, right? Now, before I should actually dive deep into the structures that is forming the cubital fossa, the muscles actually, let me explain the bones of the cubital fossa first, right? So this very bone, as you can see, this very bone of the this very bone that is contributing into the cubital fossa, this is called the humerus, right? This is which bone we have? We have the humerus. Now, the humerus is lying in the brachium, right? The humerus is lying in the brachium, right? So, brachium is basically the region that is present between the shoulder joint and the elbow joint, right? So, this very region of the upper limb is called the brachium, right? While the region that is below the elbow joint, tell the wrist, right? So, this very portion is called the antebrachium. So, in the antebrachium, we have two bones, right? So, this medial bone, as you can see, this bone is called the ulna, right? We have the ulna, right? While the lateral bone of the antebrachium is what we have the radius bone, right? We have the radius. Right. Now, as I have already told you that the cubital fossa is basically a triangular depression that is present at the anterior aspect of the elbow joint, right? So basically, this depression is found by some muscles, right? Two muscles are basically forming the boundaries of this very cubital fossa, right? One, we have the lateral muscle. I'm going to draw the structure of that very muscle. This very muscle that is forming the lateral boundary of the cubital fossa, this is called the brachioradialis muscle. This is what we have, the brachioradialis muscle. Right. Similarly, we have another muscle that is forming the medial boundary of the cubital fossa, and that very muscle is called the pronator teres muscle. So the pronator teres muscle is originated from the medial epicondyle, as you can see, right? And this muscle is what we have, the pronator teres muscle. Right. Now we have the base of the cubital fossa as well. Base is basically an imaginary line that is formed by the joining of the both the epicondyles actually, right? So we have two epicondyles in the humerus. This one we have the medial epicondyle, and this one we have the lateral epicondyle, right? So base is basically formed by an imaginary line that is joined by the both the epicondyles actually, right? So now I am going to draw the base of the cubital fossa by these dotted lines, right? So these dotted lines are forming the base of the cubital fossa, right? This is forming what? The base of the cubital fossa. Right. Now, by the joining of these two muscles, they have formed this pointed region, as you can see, right? So this very region is called what? The apex of the cubital fossa. And the apex of the cubital fossa is found by the joining of both of these two muscles. That is, we have the brachioradialis and the pronator teres muscle. When they intersect each other, they are forming this narrow region, and this very region is called what? The apex of the cubital fossa, right? Now we have the floor of the cubital fossa as well, right? So the floor of the cubital fossa is formed by a muscle, and that very muscle is called what? the brachialis muscle, right? So the base is found by the brachialis muscle. And the, right, now, so these are all the structures that are forming the boundaries of the cubital fossa actually, right? The boundaries of the cubital fossa and the floor of the cubital fossa, right? So far we have discussed that, right? Now I'm going to explain the contents of the cubital fossa, right? Now I'm going to explain what the contents of the cubital fossa, right? So for the contents, first of all, I'm going to tell you a mnemonic, and that is MBBR. That is what we have, MBBR. Let me write it. This mnemonic is basically from medial to the lateral sequence, right? That is, let's consider, now I'm drawing the cubital fossa, right? So let's consider that this is, we have the cubital fossa. This is, we have the cubital fossa. Now, using this very mnemonic, I'm going to draw the contents of the cubital fossa, right? So the first one, we have what? The M, right? So M means the median nerve, right? So this very structure that I'm drawing right now, this is, we have the median nerve, right? This is indicating what? The median nerve. Right? Just lateral to the median nerve, we have what? Another B. And this B is indicating the brachial artery, right? This B is indicating what? The brachial artery. So just lateral to the median nerve, we have the brachial artery. The brachial artery. And the brachial artery bifurcates at the apex of the cubital fossa. It is then dividing into two other arteries, right? Okay. And just lateral to the brachial artery, we have another B. And this very B is indicating the bicipital tendon. This is indicating what? The bicipital tendon. Bicipital tendon, right? And now we are just remain with this R, and this R is indicating the radial nerve. This R is indicating the radial nerve. So these are all the contents of the cubital fossa, right? We have 4 deep contents of the cubital fossa. These are what we have: the median nerve, most medially. Just lateral to it, we have the brachial artery. Then we have the bicipital tendon, and most laterally we have what? The radial nerve, right? So these are all the contents of the cubital fossa, right? Now, we have the roof of the cubital fossa as well, right? So the roof of the cubital fossa is formed by 2 structures, right? Now I'm talking about the roof. So the roof is formed by 2 structures. That is, we have the skin and the superficial fascia. Skin, first of all, we have the skin. And then we have the superficial fascia, right? Now, between the skin and the superficial fascia, we have some other contents, some superficial contents of the cubital fossa. And this contains the medial cubital vein. It contains what? The medial cubital vein. And the medial cubital vein is called the favorite site for nurses, because whenever nurses are going to inject a syringe, then what they are going to do, they are basically injecting them in the median cubital vein, right? We have 2 other contents of the superficial contents of the cubital fossa as well, right? These are what we have: the lateral and the medial cutaneous nerves, right? So what we have: the lateral cutaneous nerve, And similarly, we have the medial cutaneous nerve of forearm. These two nerves are the cutaneous nerves of the forearm, right? So this is all about the cubital fossa. I hope that you will like the video, and if you feel this very video a bit helpful, so do subscribe to my channel. Inshallah, I will meet you in the next video. Take care of yourself. Bye bye. Allah Hafiz.